This video is about stuttering modification therapy, which is in the section Adult Stuttering Therapy. If you like these videos, please buy my book, Making Stuttering Therapy Work, which is on Amazon. Okay, so in the 1930s, 1940s, 1950s, stuttering therapies were based on the then correct assumption that there was no effective treatment for stuttering. Instead, the aim was, quote, a reduction of fear and avoidance of stuttering, unquote, via self-acceptance of one's disability, open disclosure to others that one is a person who stutters, and intentionally stuttering, which is also called voluntary stuttering. And then Charles Van Riper, who was a speech-language pathologist and a person who stuttered, his stuttering modification therapy added techniques to pull out of disfluencies and to scan ahead for feared words and to use quote-unquote easy stuttering on those words. Stuttering modification therapy was developed before evidence-based practice. In other words, back when therapies were not evaluated scientifically. Only one study has been done of stuttering modification therapy. That was in 2005 and investigated 19 adults who stutter in the they were in the 3.5-week successful stuttering management program in Spokane, Washington. Immediately post-treatment, the subject's speech improved on average 10%. 6 months later, this modest gain had all but disappeared. Several measures of anxiety found a 10 to 15% psychological improvement. The researchers cautioned that this small psychological gain might not last given the absence of improved speech. The researchers concluded, quote, the SSMP appears to be ineffective in producing durable improvements in stuttering behaviors. A 2007 literature review observed that these older therapies, quote, tended to make relatively high demands on the time, skill, patience, and insight of both the stutterer and the clinician. In the hands of a poorly trained therapist, it could degenerate into little more than an attempt to teach people who stutter to live with their speech difficulty. At best, it almost never resulted in normal fluency. So that's the end of this video about stuttering modification therapy. Look below the video for a link to buy my book, Making Stuttering Therapy Work, or look for the book on Amazon. Look for a button to click to watch the next video. And if you're watching this on YouTube, please click the like and subscribe buttons below the video so that I get a share of the revenue from the ads you've seen. And my website is casafuturatech.com.